Good afternoon. My name is James Jean Justin. I'll be covering ethical issues in research surroundings and topic 4. I want to thank you for giving me the platform to research this assignment. I'll be identifying the principles of scientific communication, explain the ethical implications of in-human research as it applies to allied care professionals, analyze the ethical issues around communication when conducting research in allied healthcare field, describe how you would communicate effectively and appropriately with patients, families, and healthcare providers within scope of practice, and explain how you would demonstrate effective skills in writing formal correspondence to communicate information within our scope of practice. Let's begin. Now, when it comes to principles of scientific communication, this requires accuracy, which we should present data and findings truthfully without distortion or bias. Clarity, use clear, unambiguous language accessible to intended audience. Transparency, disclose methods, limitation, and potential conflicts of interest. Reproducibility, now provide sufficient details for others to replicate research findings. Now, when it comes to ethical implications in human research, the core ethical principles are informed consent. We start with participant must understand the risks, the benefits, and the procedures, referencing Beauchamp and Childress in 2019. Beneficence, maximize benefits while minimizing harm to participants. Justice, fair distribution of research benefits and burdens. And respect for persons, honor autonomy, and protect vulnerable populations. Now, allied healthcare professionals need to balance research goals within patient welfare and dignity. Now, ethical issues in research communication. It starts with truth telling, data integrity, conflict of interest, and publication ethics. Now, we're going to start with the truth telling and deception. Deception undermines informed consent at all times. This must be justified and minimized, referencing to Mayhem and others in 2018. When it comes to data integrity, accurate reporting of findings, no fabrication or falsification, proper statistical analysis. Now, conflict of interest. Disclose funding sources, report potential biases. When it comes to publication ethics, avoid plagiarism, credit contributors properly. Now, effective communication with patients. Now, when it comes to person-centered communication strategies, active listening, give full attention, and validate patient concerns. Give them that time to express themselves. Give them a few minutes because they may not have that concern right then and then. Give them a way of just reaching you some way, email or phone number. Cultural competence. Respect diverse values, beliefs, and preferences. Health literacy. Not everyone has that that understanding when it comes to health. Use plain language where they can understand you and avoid medical jargon, and empathize with them as well. Demonstrate understanding of patient's experience and and see how you can make their experience better next time if they didn't experience that the first time, and have a shared decision making, involve patients in treatment planning. Now, when it comes to patient-centered communication, takes into account values, beliefs, and preferences, and that's referencing Sheehan and others in 2021. Now, communication with families. Involve families in care planning, engage caregivers in discharge planning and decision-making process. Give them that time and to make a decision and involve everyone who would like to make that decision. Manage expectation. Provide a realistic prognosis while maintaining maintaining hope. Address concerns promptly. Create opportunities for questions and clarifications. Balance confidentiality. Respect patients' privacy while appropriately involving the family members. Provide emotional support. Just acknowledge family stress and offer a resource. That's very important. Like interprofessional communication. Now, we all have a breakdown in communication within the healthcare field. It could be a provider having a breakdown with a nurse. It could be a nurse having a breakdown with a PCA, or laboratory team members or respiratory team members. Just have strategies for effective collaboration. It starts with multidisciplinary care plans, collaborative person-centered documentation. Have that standardized protocol, use structured communication tools such as the SBAR or handoff procedures. Also have health information technology like electronic health records for seamless information sharing. Having a team meetings, coordinate care, and resolve conflicts. Ask your team members, what issues have, what's going on in a unit, what are they dealing with, and how can they make that area of issues better, like what can you do better? And of course, have that mutual respect, value contributions of healthcare professionals. Multidisciplinary care plans improve communication between hospitals, allied health, and primary care practitioners. That's referencing Sheehan and others in 2021. Now, when it comes to scope of practice consideration, now professional boundaries is key. Understanding your professional qualifications and limitations. Practice within state regulations and licensure requirements. Make appropriate referrals when expertise is needed. Communicate clearly what services you can and cannot provide. And documentation standards. Have that accurate, document accurately, timely, comprehensive records, and be HIPAA compliant and privacy protection. When it comes to legal and ethical documentation requirements, have that clear communication with clinical reasoning, and always practice within your scope to protect patient safety and professional integrity. Now, you need to have some formal correspondence skills, professional writing standards. Let's start. Now, clear, concise, and grammatical correct communication. Have that appropriate tone and formality for the audience. Proper citation of sources and references, and have that logical organization with clear objectives. And also research writing. When it comes to that, have a manuscript and abstract grant proposals following academic conventions. When it comes to clinical documentation, patient records, treatment plans, progress notes, discharge summaries, and professional emails, subject lines, proper greetings, clear messaging, and professional signatures. Have those in place as a professional. And some of the key takeaways we can find within our foundation of excellence. We can protect research participant through informed consent, beneficence, and respect. Now, our foundation of excellence starts with scientific communications, requires accuracy, clarity, objectivity, and transparency. When it comes to person-centered care, communicate effectively with patients, family members, colleagues, using empathy and cultural competence. Professional responsibility. Now, we all have a responsibility as a professional. Practice within your scope. Maintain documentation standards and uphold ethical principles in all aspects of allied healthcare practices. I leave you here. I want to thank you for giving me this platform to express my findings, and thank you. Once again, my name is James, and I hope you have a wonderful day. Thank you, Professor Oliver Burrow.